Having examined the patient's vital signs, what would be your next step?
Well, before proceeding to the formal observation, it's always good to be on the lookout for silent signs from the moment the patient walks into the consulting room. And this can also be done during history taking and especially before they've become conscious of the examination procedure.
We observe subtle signs such as the way they walk into your room, their gait and how they sit, evidence of pain, breathlessness, limping or discomfort. We assess their handshake, feeling for temperature, hydration, strength, deformities and signs of tremor. We note the patient's expression, language and articulation, their mental status and mood, the patient's personal hygiene and state of dress. And if relevant, we note their socioeconomic background and general appearance. Have you been able to detect the patient's breath? It is possible at this early stage of the observation that you may detect a characteristic odor. These may signify throat or pulmonary infection, uremia, liver disease, gastroesophageal reflux, alcohol consumption, or diabetes. Having recorded the vital signs and made a brief observation of the patient, we now proceed with a full general examination. A physical examination can be an embarrassing and frightening experience for some people. Make sure you explain to them clearly what you're going to do and, if appropriate, tell them why. In some instances, you may need to obtain written consent or have a chaperone present. Afsana, how do you approach the issue of undressing the patient?
Well, it depends on the nature of the examination, and depending on this, you need to invite the patient to undress accordingly. For general examination, ask the patient to undress down to their underwear.
It may be appropriate to provide a screen for the patient to undress behind. If the patient keeps their clothes on, you might miss hidden important signs. Remember, it is equally important to preserve the patient's modesty. If you ask the patient to remove too much clothing and in an unsuitable setting, you risk embarrassing the patient. Remember to offer assistance to the elderly, the disabled, and those in acute pain. Cover parts not being examined immediately. This also helps to keep them warm. It is useful to perform a thorough visual scan of the body for external signs of pathology. For example, swellings, scars, edema, rashes, or other visible lesions. This is a brief general scan. A more detailed examination will follow. This is done in a progressive regional approach rather than being system-based. Start with the face, then move to the neck, abdomen, then pelvis, and the limbs. During this brief scan, look out for any overt signs of disease. Note their mental status, the shape of body and limbs, any gross deformities, their color, state of hydration, any lesions, rashes, wounds, or scars.
I'm going to examine you now, Mrs. Smith. Tell me if you feel cold.
Okay.
Thank you. I'm going to have a look at your legs now.